All right, let's jump into something pretty interesting today.
Okay.
We're going to be taking a deep dive into the world of German nursing and specifically looking at this tool they use called SIS.
Okay.
That's short for Strukturierte Informationssammlung,
Yeah.
but we can just call it SIS for short.
Right.
Our guide for this deep dive is going to be a German nursing expert, Schwester Eva,
Yeah.
and we're going to be looking at her blog posts on this topic.
Excellent.
And what's so interesting about SIS is it's not just like a form.
Right.
It's like a whole system for trying to make sure patients get really great care.
Yeah, that's right.
So,
And it's mandated for care evaluations in Germany. So
yeah.
it's a pretty big deal over there.
Okay, so tell me a little bit about, like, what is it and what problem is it trying to solve?
So think of it this way.
Okay.
Imagine you're a nurse and you need to come up with a care plan for a patient.
Right.
To do that well,
Mm-hmm.
you need a really good understanding of their needs, right?
Of course, yeah, you can't just assume you know what's best for them.
Exactly.
Yeah.
And that's where SIS comes in. It's a structured way to collect and organize information about a patient's physical, emotional, and social needs.
Okay.
This way you ensure that every aspect of their well-being is being considered, not just the obvious medical stuff.
So it's like a framework for getting a full picture of the patient.
Exactly.
Gotcha.
And what I think is really interesting about it is that it places a lot of emphasis on the patient's own perspective.
Okay.
Like there's a whole section dedicated to their voice, their concerns, and their goals for care.
I love that.
Yeah.
That's a great way to, like, really make sure the patient feels heard and that the care is truly tailored to them.
Right.
Yeah.
It shifts the power dynamic a bit, moving away from that old model where the doctor knows best
Yeah.
towards something more collaborative.
Right.
And I think this emphasis on patient perspective is part of a larger trend we're seeing in healthcare in general.
Yeah.
A real move towards shared decision-making and patient empowerment.
Yeah, for sure.
Yeah.
Well, and I imagine having all of this, like, meticulously documented is helpful for the nurses too, right?
You're spot on. It's
Sure.
like for their own.
It serves a lot of purposes.
Yeah.
From, like, a legal and quality assurance standpoint.
Uh-huh.
It provides a clear record of the care that's been given.
Right.
That can be super important if there are ever any questions or audits.
Yeah. You want to make sure everything's all
Exactly.
Yeah.
And it also helps ensure continuity of care by making sure everyone on the healthcare team is on the same page.
Right. So everyone can reference the same document and be like, okay, this is what's going on. Okay,
Yeah.
that makes sense.
So,
But you mentioned that it goes beyond just information gathering.
yes.
It's like a 4-phase process.
Yes.
What are those phases?
So it starts with structured information collection, which is where the form comes in.
Okay.
Then, based on that information, nurses develop an action plan. Right.
To address the patient's needs.
Makes sense.
The third phase is documentation and communication through a report sheet that summarizes the key findings.
Okay.
And finally, there's an evaluation phase
Okay.
to make sure the plan is working,
So they go back and check in and see,
Yes.
okay, how's this going?
to make adjustments.
If we need to change anything?
Yeah.
All right.
It's a dynamic cycle
Gotcha.
designed to keep the care plan relevant and effective.
That makes a lot of sense.
Mhm.
So, okay, so speaking of effective, how does this actually work in practice? Do nurses just, like, walk around with a form and, like, a checklist?
Not quite.
Okay.
It's more nuanced than that.
Okay.
I like to think of it as a framework
Mm-hmm.
that guides their interaction with the patients.
Okay.
It involves interviews, physical examinations, reviewing medical history, and really listening to the patient's concerns.
Yeah.
The form is just there to help organize and standardize the information,
Right.
but it's not meant to replace the human element
Like,
in nursing.
so it's a tool to support good nursing care,
Precisely.
not like a script to be followed blindly.
Exactly.
Okay.
And it's important to remember that even with a tool like this,
Uh-huh.
nursing still requires a lot of critical thinking and clinical judgment.
For sure.
You can't just rely on a form for everything.
Yeah, that makes sense.
Yeah.
So I'm curious about the risk matrix component of SIS.
Okay.
It sounds like a helpful way to identify potential problems early on, but could it also be a bit limiting?
That's a really interesting point.
Yeah.
You see, the risk matrix in SIS
Yeah.
is designed to flag general risks,
Mm-hmm.
things like falls, bed sores, or malnutrition.
Right.
It gives you a broad indication
Okay.
of potential problems.
Gotcha.
But sometimes you need a more specialized assessment to the full picture.
Yeah. So, like, the risk matrix might say they're at risk for pressure sores,
Yeah.
but it won't necessarily tell you how to prevent that.
That's a good way to put it.
Yeah.
And that's where expert standards come in.
Okay.
Things like the Braden scale for assessing pressure ulcer risk.
Right.
It's like having a magnifying glass to zoom in on a specific issue.
To really look deeper.
Exactly.
Okay, so even though SIS aims for simplicity,
Yeah.
there are times when you need to dig deeper and use more specialized tools.
Exactly.
Yeah.
And that tension between the standardized tools
Oh.
and the specialized assessments
Yeah,
is something we see a lot in healthcare.
for sure.
It's that balance of efficiency
Right.
with making sure that nothing important slips through the cracks.
Yeah,
It's something worth pondering, I think.
it is.
Especially when it comes to your own healthcare.
Yeah, that's a really good point.
Yeah.
It's making me see how the SIS kind of reflects some of the bigger questions
Absolutely.
and challenges in healthcare.
It does.
Yeah.
And that tension between efficiency and thoroughness
Mm-hmm.
is just one of the many fascinating aspects
Yeah.
of SIS
Hmm.
that we're going to unpack today.
Sounds good.
Yeah.
You know, it's interesting how this seemingly simple tool, this SIS thing, is bringing up these like bigger issues.
Yeah. It is fascinating.
In healthcare.
Yeah, it's like a microcosm of those bigger tensions that we see playing out
Mm-hmm.
in healthcare systems all over the world.
Yeah, for sure.
You know?
It's like we want to be efficient.
Right.
We want things to be streamlined.
Yeah.
But we also need to make sure that we're not sacrificing quality of
Yeah.
care in the process.
It's all about striking that balance.
Yeah.
You know, finding that sweet spot.
Yeah. And especially in today's world where healthcare workers are often stretched so thin.
Absolutely.
Like, how do we find...
You can't just rely on tools
yeah.
to do everything.
Yeah.
The human element is
Yeah.
essential.
Absolutely.
It's really where critical thinking and clinical judgment come into play.
Right. And I'm thinking back to Schwester Eva's blog posts, and she seemed to really emphasize that point about training professional development for nurses.
Couldn't agree more.
It's not just about filling out a form.
No.
You need to understand the bigger picture.
Exactly.
Yeah.
A good nurse will use the SIS as a starting point,
Mm-hmm.
but that they also need to be able to draw on their own experience, knowledge, and intuition.
Yeah, to make sure the patient is getting what
Yeah.
they need.
Exactly.
Yeah.
It's about seeing the SIS as a tool,
Mm-hmm.
not a rule book.
I love that.
Yeah.
That's a great way to put it.
I think what's really fascinating to me is that emphasis on patient-centered care.
Yeah.
You know, having a whole section dedicated to the patient's voice,
Right.
their concerns.
Yeah, it's their health.
Yeah,
They need to be involved.
exactly.
Yeah.
That's not something you see in every assessment tool.
I know, and I think that's such an important element.
Yeah.
That's what I love about this. You know, and it really aligns with that bigger shift in healthcare towards shared decision-making and patient empowerment, recognizing that the patient is the expert of their own experience.
It's about respecting their autonomy
Yeah.
and their right to be involved in their own care.
And to make informed decisions.
Exactly.
Yeah.
So, you know, with all these benefits,
Uh-huh.
are there any potential downsides,
That's a great question.
you know, to a system like this?
Yeah. What are the cons?
Yeah, like Schwester Eva
Uh-huh.
hinted at a few concerns.
Yeah, I remember she was talking about the risk of, like, medicalizing patients.
Yes.
What does she mean by that?
So when you have a system
Okay.
that is so focused on
Mm-hmm.
structure and data,
Okay.
there's a danger of reducing the patient
Right.
to just like a collection of diagnoses and risk
What
factors.
if they just become data points?
Exactly.
Yeah.
We start seeing them through the lens of the tool rather than as a whole person
Right, with a story.
with a unique story
Yeah.
and individual
And
needs.
feelings.
Absolutely.
Yeah.
And while data is important,
Mm-hmm.
it's crucial that we don't lose sight of that human element.
Yeah, I totally agree.
And that's where the role of the nurse is so vital.
Right.
They need to connect the dots,
Yeah.
see the patient as a whole.
Yeah, to see the human
Yes.
behind the data.
Exactly.
And it makes me think about another point that Schwester Eva brought up
Okay.
about the pressure on nurses
Yeah.
to document everything perfectly
Oh, yeah.
because of the potential for legal scrutiny.
Absolutely.
That must create a lot of anxiety.
It does.
Yeah.
Especially in a system where documentation is so closely tied to quality assurance.
Yeah, like that must be hard.
Yeah, it's a real concern.
Yeah.
And it can lead to what we call defensive documentation practices,
What's that?
where nurses might feel pressured
Oh, okay.
to overemphasize risks
Right.
or even document things that didn't actually happen.
Oh, wow.
just to protect themselves.
So it's like a catch-22.
It is a bit of a catch-22.
Yeah.
You're trying to provide quality care,
Yeah.
but the very system that's supposed to ensure quality
Uh-huh.
ends up creating these pressures
That could undermine it.
that could potentially undermine it.
Yeah.
It's complex.
It is.
It raises important questions about how we create healthcare systems
Yeah.
that support the well-being of both patients and healthcare professionals.
Right. Want everyone to thrive.
Exactly.
Yeah.
Systems that prioritize compassionate, individualized care
Yeah.
while still ensuring accountability and quality.
Absolutely.
It's a tough balance to strike,
It is.
but it's one worth striving for.
Well, I think this is a perfect point to kind of pause and reflect on what we've learned.
Yeah.
So far.
Okay.
We've kind of unpacked the mechanics of the SIS.
Right.
We've explored the benefits, the challenges.
Yeah.
And we've started to see how it reflects some of these bigger trends and tensions.
Exactly.
Healthcare.
Absolutely.
Yeah.
We've covered a lot of ground.
We have.
And as we move into our final segment,
Okay.
I want to bring us back to that question I posed earlier.
Okay.
How do systems like the SIS,
Mm-hmm.
with their focus on structure and data,
Yeah.
impact the balance of power
Okay.
between patients, nurses, and healthcare institutions?
That's the question that's been in my mind, this
Yeah.
whole deep dive into SIS.
It really is a thought-provoking one.
It is.
And I think it's relevant in any healthcare system,
Yeah. Not just Germany.
not just in Germany. Yeah.
It's like, who has the power?
Right.
How does that impact the care that's being given?
Exactly.
So let's break this down a little bit.
Okay.
On the one hand, you could argue that the SIS actually empowers nurses.
Yeah.
It gives them this framework
Mhm.
for assessment and documentation,
Right.
a way to really articulate their observations and make recommendations based on a standardized system.
It gives them a stronger voice in a way
Yeah.
and some clearer guidelines to follow.
Exactly. And also some legal protection
Right.
for nurses too, right?
Yeah, it's-
By ensuring that they followed the procedures
Yeah.
and documented everything.
Yeah. It's like a safety net in a way.
Yeah. But then there's that flip side too.
Right.
Could it also shift power away
Potentially. Yeah.
from nurses
Yeah.
and more towards the institutions?
That's the tension.
Yeah.
If institutions become overly reliant on the SIS as the main way to assess patients,
Right.
it could actually limit the nurse's ability.
Right. To use their own judgment.
Exactly.
Yeah.
To deviate from that standard protocol
Right.
when it might be necessary.
Yeah. So it's the tool is dictating the care
Right. Instead of informing the care.
rather than being used as
Yeah, it's losing that flexibility.
the tool
Yeah.
to help inform it.
Exactly.
And that shift in power, I imagine,
Yeah.
could also impact the patient's experience.
Oh, absolutely.
Yeah.
If they feel like they're being treated more as a data point
Yeah, just the number.
than a person,
Yeah, yeah.
it can really impact their trust
Yeah, for sure.
in the healthcare system.
And their relationship with their caregivers.
Exactly.
Yeah, so it makes me wonder, is the SIS primarily designed to improve patient care
That's a good question.
or to protect institutions?
It's probably a mix of both,
Yeah.
to be honest.
Yeah, it's
It's
probably
a bit of a gray area,
Yeah, a little bit of both.
but it's a question worth asking.
Yeah, for sure.
When we implement these kinds of systems, we have to be mindful
Mm-hmm.
of who benefits
And what are we losing?
and what the trade-offs are.
Yeah.
You
I'm starting to see how SIS is
Yeah.
this perfect example of this interplay between technology,
Yeah, it's fast.
power dynamics,
Absolutely.
and the human element
Yeah, it brings it all together.
of healthcare.
It does. It highlights the need for ongoing conversation
Mm-hmm.
and critical reflection
Yeah.
about how we use technology in healthcare.
Yeah. We can't let these tools run the show.
Exactly. We need to use them thoughtfully
Right.
and intentionally,
Yeah.
always with the patient's well-being in mind.
Yeah. I think that's a great takeaway.
Yeah.
As we kind of wrap up this deep dive into the SIS, what are some things you want listeners to remember?
I'd say first and foremost,
Okay.
remember tools are just tools.
Yeah.
They can be helpful,
Mm-hmm.
but they can also be limiting.
Right.
We have to use them critically, recognizing both the strengths and the limitations.
And balance that with the human element.
Absolutely.
Yeah.
Data can't capture everything.
Of course not.
We have to remember that behind every data point is a human
The
being
thoughts and feelings.
with their own story and their own needs
Yeah.
and fears and hopes.
It's more than just checking boxes.
Exactly.
Yeah. That's where the art of nursing comes in.
Absolutely.
Yeah.
Listening to those stories understanding those needs,
Yeah.
and providing compassionate care.
I love it.
That goes beyond
Yeah.
just filling out a form.
Well, this has given me a lot to think about.
Good.
I hope it's given our listeners a lot to think about.
Me too.
It's amazing how exploring one tool in German nursing
I know. It's fascinating how these things connect.
can lead to these big questions
Yeah.
about healthcare.
Absolutely.
Yeah.
It's a testament to how complex these issues really are.
They are.
And remember, this conversation doesn't end here.
Yeah. Keep thinking about it, everyone.
Keep asking questions.
Yeah.
Keep exploring these topics.
All right.
And keep pushing for a healthcare system that really puts people first.
Couldn't have said it better myself.
Good.
Thanks for joining us for this deep dive into the SIS.
Yeah, thanks for having me.
Until next time.